You know that. Hey, Ms. TF.
Hi.
I'm Michael, family nurse practitioner student with United States University. Going to be conducting a head, eyes, ears, nose, and throat examination today. Do I have your permission to record this examination for the use of my instructors and possibly other students?
Yes.
Okay, thank you very much. So first thing I'm doing as I walk into the room, I'm just taking a look at your head. I'm looking at the size, the shape, the symmetry. I'm also looking at hair distribution, looking for any alopecia, also looking at the hair itself, coarseness, fineness, that type of stuff. I'm just gonna go ahead and feel on your head here, and I'm feeling for any bumps, lumps, soft spots, anything like that, any tenderness of which none was found. We'll move on to your eyes, okay?
Okay.
At this point, I would conduct a Snellen chart exam. This would be held at 6 feet. I would ask my patient to read the smallest line possible with both eyes. I would then ask her to cover one eye, read the smallest line possible, uncover that eye, cover the next eye, and repeat the process. And that would be the Snellen eye chart exam. Moving on, I'm going to get my trusty fundoscope or ophthalmoscope, if you will. And I'm going to make sure that that's working, and we have the brightest aperture set on there. All right, so also have you stare straight ahead, just from a tangential view, which means from the side. I'm just going to take a look at her eyes, looking at the shape, the contour, looking at the sclera, make sure that that's clear. We're also going to come in here, pull down and look at the conj, pull up and look at the conj, as well as the palpebral fissures, lacrimal glands, lacrimal ducts, things of that nature, and everything looks fine, okay? So now I'm going to test you for visual confrontation, okay? So I want you to look at me, let me know when you can see my fingers.
No.
Okay, and we're just going to repeat that on the individual eye,
No.
and again.
No.
Okay, good. I'm going to test for extraocular motion right now. This is going to test cranial nerves 3, 4, and 6. So follow my finger, just your eyes only. And we're going to go up and checking the 6 cardinal fields of view. And we come over here to the lateral, also observing for nystagmus. And now what I want you to do is focus on a spot on the wall, and then my finger, and we're going to bring that right in. And so that's checking for accommodation, which means that as she focuses her exam, the pupils will focus in on the object that she's looking at as well as constrict. So everything was normal with that, okay? So now moving on, I'm going to check for pupillary dilation. So just again, stare at my nose. Okay, so we're doing this twice over each eye. The first time I'm looking at the one that I'm shining the light in, if that constricts. The second one is looking to make sure that it does it on the other side. Okay, so we'll repeat that again. And there that is. And again, perfect. Okay, next we're going to go ahead and dim the lights in here. Just want to let you know, I'm going to be getting up close into your face. We're going to take a look at the back of your eye, okay? So again, we'll dim the light in the room, get my ophthalmoscope on. I'm going to place my hand over here on her shoulder just to give me a reference point. I also have my pinky out here in case I get too close. I'm not going to end up poking her. So put the ophthalmoscope up, and there's the red reflex, and I'm going to just move straight in here. And we are visualizing the optic disc and cup. The ratio is 3 to 1. I also see the vasculature, and I don't see any cottonable spots. I don't see any AV nicking, anything like that. I'm sorry, that's super bright.
It's okay.
We would repeat this process on the other side as well. Moving on, that completes the nose, or the eyes. We're going to move on to the ears. Again, going to observe for any lesions, any abnormal shape, size, symmetry, that type of stuff. Also just going to give a little pinch here on the tragus and on the pinna. And are you having any tenderness with that?
No.
No, okay. You can also do the whisper test at this point. So I'd have you occlude one ear for me. Go ahead, plug that here. And do you hear that? And let's try that on the other side. This can also be done with a ticking watch or whispering a series of vowels or numbers into the patient's ear and having them repeat them back to you, okay? Let's go ahead and take a look inside your ear real quick. I'll switch out the head here. And we're going to put a fresh speculum cover on this otoscope. Come on. Someone's giving me business. Give me a hard time. There we go. There we go. Okay. All right. So again, I've palpated that tragus and that pinea, and I don't see any redness on the external auditory canal that I can visualize from this point. So I'm going to go ahead and grasp the earlobe and retract that back. And again, I'm bracing so that I'm not jamming this into her ear canal. And we're taking a look, and I see a cone of light, and that is at 5 o'clock where it's supposed to be. I also see the anatomical landmarks, and I'm advancing the speculum out. I just take a look at that external auditory canal for any redness. Also looking for cerumen impaction, things of those nature. Some otoscopes have a little bulb on it where you get a little puff of air in there. That's going to observe for the tympanic membrane, for mobility. Another thing that I could ask you to do is a Valsalva maneuver. Plug your nose, keep your mouth shut, blow. That'll increase the pressure in the middle ear, and I should be able to visualize the TMs bulging. So anyway, would repeat the process on the same side, or the contralateral side, excuse me. Moving on to the nose, again, I'm going to observe, looking just down the middle, I'm looking to make sure that I don't see any septal deviation, no gross deformities. Go ahead, plug one side for me, breathe, okay? And repeat the other side. And so both nares are patent, she's able to get a good breath in and out. I'm just gonna take another look here. Maybe, yeah, right? High quality. Anyway, assuming that my light comes on, I have you tilt your chin up for me. I'm just gonna go ahead and grab her nose and just push the tip of that back. And we're gonna get a look up in there, and I'm observing the nasal mucosa, which was pink and moist. I was also able to visualize the first set of turbinates, and I did not notice any polyps or septal deviation, and no erythema or bleeding or anything like that from Kesselbach's plexus. Moving on, I'm gonna take a look inside your mouth for me. Or, yeah, I'm gonna take a look inside your mouth. Okay, go ahead, open up for me and say, ah. Okay, so a couple things going on right there, right off the bat. I'm looking at for the equal rise and fall of the soft palate, the uvula midline. Also taking a look at the oropharynx there, looking at the color, looking for any exudate, any erythema. Also taking a look at the tonsils. They were tucked away nicely in the tonsillar crypt. Go ahead, open back up for me. Just gonna take a look here at the buccal mucosa, looking for Koplik spots. Quick look at the teeth. Push against that tongue blade for me, good. And the other side. So between that with the equal rise and fall of the palate, the uvula being midline, and her pushing the tongue blade against that, we checked cranial nerves 9, 10, and 12. One more thing for me, bite down, okay? And I'm just gonna test the strength of her teeth, and I didn't feel any teeth moving or anything like that. So that's gonna complete that portion. The other thing here, just wanna check these sinuses. So these are the frontal sinuses up above the eyes, maxillary sinuses here. Any tenderness with that? Okay, I'm gonna go on and continue further on and check your lymph nodes here. So we're checking anterior cervical, occipital, coming around here, posterior auricular, preauricular, going submandibular, submental, anterior cervical, all the way down, and then supraclavicular. And I don't feel anything. Did you feel any tenderness? Okay. Well, that's going to complete our exam for today. All right. Thank you for coming. I appreciate it. Thank you.